Hi, I'm Tamara Thomas, Editor-in-Chief for Urban Health Today, and I'm speaking with Dr. MarkAlain Déry, an infectious disease physician and public health practitioner. He's also the Chief Innovation Officer and Medical Director for Infectious Diseases at Access Health Louisiana, the largest federally qualified health center in Louisiana with 35 clinics statewide. With an emphasis on human rights and social justice, Dr. Déry founded 102.3 FM WHIV LP, a community radio station in New Orleans. In addition, he started a daily 10-minute podcast called COVID Noise Filter for reporting on COVID through a social, economic, and racial justice lens. That show is syndicated across the country through the Pacifica Network. More recently, he has been creating animations to help explain the COVID vaccines and HIV. Thank you for your time today, Dr. Déry.
Thank you so much for having me on.
All right, let's get started. So, you're an infectious disease specialist and a public health expert. Can you talk a little about what led you to those disciplines?
Yeah, absolutely. My family is originally, I'm a first-generation American, and my family's from North Africa, from Morocco. That's where both my parents and their parents have come from. And so when my dad immigrated to the US, he was already an optometrist in France and had to go to school all over again. Found ourselves in Los Angeles, and my father unwittingly found himself as the only person who can make definitive HIV diagnoses in the early days of the HIV pandemic, when they didn't even have tests or they didn't even really understand what HIV was. We're talking very, very early days. But you could have a condition called CMV retinitis, where you're able to look into the back of the eye and make a diagnosis definitively that way. So my father was kind of on the forefront of HIV work, and I was probably at that time 13, 14 years old at the time. And my father would come home, or he would take me to the office. He would show me what the HIV pandemic was looking like. And at that time, this was mostly, if not almost exclusively, gay young men and men who have sex with men. And so what struck me was, one, how this virus, which I came to understand what a virus was in my early teen years, and it fascinated me beyond belief, but how it also affected a certain portion of a population, in this case, men who have sex with men, then of course IV drug users, and then of course hemophiliacs. And so together with that, I was really struck at a very, very young age at the idea of epidemiology and the idea of how infectious diseases and epidemiology kind of overlap. And that's ultimately what I ended up becoming, was an infectious diseases physician as well as a epidemiologist, because of that early childhood fascination of HIV. But more than that was watching my father's compassion. You had people who were being kicked out of practices all over Los Angeles because of the fear of the unknown. In those days, of course, LGBT community was far more stigmatized than they are now. And so my father, just coming from a completely different culture, coming from Rabat and Casablanca in Morocco, it was foreign for him to see this level of stigma. And my father responded with an enormous amount of love and compassion, and that he very, very much passed on to my brother and myself. My brother is an expert in mRNA. He became a scientist and has been doing mRNA research for about 25 years. And I've been obviously an infectious disease doctor and an epidemiologist for more or less the same amount of time as well.
Also, you're a second-generation epidemiologist.
Well, I guess to a certain degree. I mean, I don't think my father would call himself an epidemiologist. He just found himself just in the middle of this, enormous wave of HIV, and he was practicing in Hollywood. So not only that, but he was also kind of like, he was because he's also very, he's French and he's very like suave, and so he had this huge clientele of Hollywood stars. And in the 70s, my dad was the man in Los Angeles when it came to eyewear, eye care, and that sort of stuff.
Okay. As a healthcare provider in Louisiana, you're pretty much right on the ground when it comes to seeing disparities in health, medicine, and medical care. Can you talk about why Louisiana and why you chose advocacy work?
Sure. So initially, when I first became a physician and graduated from medical school, the idea was to kind of get a job on the international stage, the international public health stage, work for WHO, which I've actually have done before in the past, especially during the Ebola epidemic. And the idea was to kind of follow pandemics, but I needed to do my ID fellowship first, obviously. So I chose New Orleans because of music, and I'm a big lover of music, and I also am a musician. Although it's hard to call myself a musician in New Orleans, where I feel like I'm in kindergarten compared to all the PhDs that walk around here with respect to their ability to play music. And the idea was to kind of have a home base, but to really kind of focus on being international. But when I got here in New Orleans, where I did my fellowship, there was a very strong sense for me to stay. My mentors were trying to get me to stay and focus on HIV in New Orleans. They repeatedly said, you don't need to go anywhere to find viral pandemics. We have a pandemic happening right here, and that is HIV. And we have seen in New Orleans that we have the highest rates in the country for new diagnoses of HIV. And that's largely we're usually number 2 or number 3. Miami's usually number 1. Baton Rouge, which is about 90 miles west of here, is usually number 2 or 3. We flip-flopped. And why Southern Louisiana? Well, because we have the highest rates of poverty in Southern Louisiana. We have the highest rates of illiteracy. We have the highest rates of homelessness. We have the highest rates of other sexually transmitted infections. And more than anything else, and most importantly, is that we have the highest rates of incarceration in the world here in Louisiana. And in fact, not too far from me is the Orleans Parish Prison. And that incarcerates more people per capita than any other system, any other prison in the world. And so when you put those 5 elements together, what you really are looking at is a function of really systemic discrimination that exists in society, that have been put into place for hundreds of years, for centuries, that have laws that have been created, that have been tweaked to ultimately get the outcome that we're seeing right now. So when we look at a state like Louisiana that is 70% white and 30% Black, why is it that you have 70% Black people having HIV and 10% people who are non-Black, particularly white? That disproportionate amount of individuals is not a bug in the system, but it's a feature of the system. And so my advocacy work, both as a physician and just as a human who occupies space on the globe right now, is to overturn that, is to fight against that system that has led us to where we are now. And one of the ways I've been able to do it is naturally these animations I hope we're going to talk about in just a moment, these animations that I've been making, but was to start a radio station, as you mentioned in the intro. Here in New Orleans, it's an FM radio station. Once every 40 or 50 years, the FCC comes through a town and just happens to say, here are some dials that we're going to open up for a brand new radio station. I happen to be at the right place at the right time. Namely, I was in Cambodia in a rickshaw on the way to a hospital to do a lecture when I was listening to a podcast, and I take my news through my ears. Like I said, I'm a musician. So they announced it in the news show that I was listening to, Democracy Now! And I memorized the website when I came. Yes, Amy Goodman is my hero, right? So they announced it on, and she's a fan of WHIV. I understand that. I've been told that she's a fan. And so I started the radio station. I memorized I memorized the website when I came home that night from the hospital. I looked it up. Sure enough, New Orleans was set to get a couple of these radio stations. And I just through a series of very, very lucky occurrences, we got the station off the ground. We got it funded. And right now it's 102.3 WHIV. We're the only radio station in the country that is truly dedicated to human rights and social justice. When you listen to WHIV, we've been on air for 7 years now. WHIV looks and sounds like New Orleans. And that was the goal to do that, was to make sure we have a large LGBT community, here in New Orleans. We made sure that WHIV matches that. We have a very, very diverse, New Orleans is a very, very diverse city, and wanted to make sure that our DJs and show hosts, we have about 80 volunteer DJ and show hosts. And during the pandemic, obviously as an infectious diseases physician, I was very busy, still am, as we're dealing with this Delta surge right now. But the radio station and all of the DJs really kind of banded together, knowing that I had to take my eyes off the station and really focus on what was happening with the pandemic. And they continued their strong work of advocacy. The people who are on the station really focus on issues that really matter, not only here to the community in New Orleans, but on a larger scale in the US as well. And we really do focus on issues that matter: climate change, reproductive rights, gun violence, and from an HIV perspective, of course, inequities that exist in the healthcare system.
Can you paint a picture of, I mean, the statistics you've just given are astounding. Can you paint a picture of the complications of the intersection of COVID-19 and HIV levels in Louisiana? How is that on the ground for you as an infectious disease specialist?
Fortunately, people, certainly within my practice, I have about a 95 to 99% rate of viral undetectableness. In other words, the viral loads, HIV viral loads, are undetectable. And what we have seen through very, very good research has been that people who are living with HIV who are undetectable do not have not been getting COVID at higher rates than the rest of the, but your point is very, very well taken. Who is getting COVID? The risk factors that lead to HIV, the ones that we had talked about earlier: poverty, homelessness, or housing instability, food instability, the illiteracy, those are the same risk factors that also increase the likelihood for COVID. And that's largely due to the fact that that especially in the peak of the pandemic, when we were all indoors, who was working besides folks like myself, right? Of course, you had the healthcare system that was continuing to work, but also you had clerks at stores, right? You had pharmacy techs, you had bank tellers. And what we're looking at are people who are typically, and they were largely at the beginning unmasked, and so they were at the highest risk for COVID. And also, unfortunately, these are jobs that are not on the high, these are mid to lower paying jobs. And so again, you have those that are at the lower socioeconomic scale that are at the greatest amount of risk with respect to exposing themselves to COVID and being COVID positive. And so again, these are cycles that run over and over again that, of course, your journal documents regularly about how these things work. And again, it's so important for folks like myself to have a platform like yours to be able to talk about these things, because we have to break this cycle. These are cycles of poverty. These are cycles of generational poverty as well. And until we break these cycles, we're going to continue to be in the situation that we're in right now. And so it's so important for us to really advocate for living wages. It's so important for us to make housing as a right, as health as a human right. And these are all things that we need to advocate for, but that in the system that we're in right now just does not work for us. And unfortunately works for donors who donate to the political system. And that's who's really gaining from the system that we're in right now.
How did you and Dr. Eric Griggs team up on this journey?
So that's Doc Griggs right here. And Doc Griggs is also a physician at Access Health. And before I was at Access, Eric and I started a radio program together at WHIV. And we just thought, well, let's just get on air and let's just see what happens. And so it turns out that Eric and I have a great on-screen interactions. We like all of a sudden, the first day that we were on a show together, the station manager came in, was like, we're getting calls. You guys are like really funny. Like, you know, it was just talking about healthcare stuff, but Eric and I are really funny. I'd like to think that we're funny. We've been told that we're funny when we talk about healthcare stuff. And even if we don't plan a show, it became for years, we would just sit down and I'd be like, what do you want to talk about? He's like, I don't know. We would just turn on the microphones and just talk about whatever would come up. And it just worked for us. And so because we had already developed this on-air persona, Eric is already as a celebrity here in New Orleans. He does a lot of media, and he is on a local news station every day doing medical kind of updates, talking about medical affairs of the day. So when COVID hit, it just became a natural extension for us to start a daily podcast. As you mentioned, got picked up by Pacifica Network, is now estimated to about have 80,000 listeners a day. It's a 10-minute daily podcast, again, focusing on COVID, but we take it from the lens of social, economic, and racial justice. That's incredibly important for Eric and I to talk about. We started a daily kind of streamcast on Facebook and YouTube. And more recently, we've been working on these animations, and these animations for us have become like the most important work that we've done, because we are really able. So the first video we did was just, how does mRNA vaccine work?
Right.
And
because,
pardon?
So I saw that one's pretty and cute.
Yes, thank you. That's what we want to make. We want to make them informative, and we want to make them cute. We want to make it, you know, and you can find those at noisefiltershow.com. And so the mRNA vaccine, just nobody understood. I mean, the late people did not have a very good understanding of how these vaccines work. And so we started these animations, and then that was so good. They were like, well, can you do another one? So we did one on variants and the need for booster vaccines, and which are right now. I mean, we wrote that script in April, anticipating that we would be where we are now with booster vaccines going to be necessary. And then we secured funding to do 3 more on HIV. So we're talking about U equals U, undetectable equals untransmittable, PrEP, and then NPEP. So that's protecting yourself from exposure of HIV. And NPEP is kind of like plan B, where you would have emergency contraception. Here, NPEP is emergency use of HIV medications after an exposure. And then we were able to secure funding for a 1-minute video on Hep C. So we're doing a musical, kind of like a Schoolhouse Rock. So we're going to do a musical on how to getting tested. You know, the idea that Hep C causes cancer. So you want to get tested, treated, and cured. We want to do that in a minute. But the one that we're most excited about right now is we got funding from Tulane University, my and Eric's former alma mater, is to do one on how to, is looking at clinical trials. And the idea is increasing racial diversity in clinical trials. Certainly we saw over the course of the past year and a half or so, that the need for increasing diversity in clinical trials for the COVID vaccines was so incredibly important. And so we're using Irma Thomas, who is a big name here in New Orleans. She's the soul queen of New Orleans as a singer, still touring to this day. And so Irma Thomas, Dr Griggs, and myself do this epic adventure where because Eric is also a musician, I'm a musician, and so we're going to be playing in Irma Thomas's band. And in the meanwhile, while we're racing to make the gig, we learn along the way the importance of clinical trials. And really what we also are doing in this video is addressing the elephant on the table by taking on and letting the medical field turn the mirror onto itself and recognize that as a field, we have done horrific things to communities of color, to sexual minorities, and to women, and that it's important for us to recognize that, because we need to look backwards and understand what we've done so that we don't make those mistakes moving forward.
Can you talk a little about your work with the LGBTQIA plus community, particularly the very marginalized trans community?
Yeah, so, you know, being an HIV provider here in New Orleans, of course, my exposure to the LGBT community for many obvious reasons. And so for me, when I started WHIV, it was incredibly important for me to make sure that there was many voices that belonged to the LGBT community. At one point, we had pre-pandemic, we had 5 people of trans experience on WHIV, and probably about a dozen other individuals who identify in the LGBT community. There's no question that when we had 5 people of trans experience on WHIV, we had the most trans individuals or people who experience people of trans experience than any other radio station or media platform across the United States, or even anywhere in the world for that matter. I'll tell you this story. When I was in Sierra Leone for the Ebola epidemic, and UNAIDS had found out that I had a radio station called WHIV. I had met with them, and I started supplying them with recordings of a person for whom used to have a show, doesn't have a show on anymore. He became very busy, but his name was Dorian Gray Alexander. Yes, his name is truly Dorian Gray Alexander. He's a person living with HIV. The first person that we gave a show to, because we thought it was so important. He's a person, he's a male, he's a person of color, also living with HIV, and he stutters. And that was the first show that we gave because we really were so committed to giving people voices on WHIV, even voices. And Dorian's voice is one that most people would never consider putting on air. But for us, it was so important to put somebody like Dorian on air. And his name of his show was Proof Positive, and he ran that show for about 6 years, right up until about mid-pandemic. And so what I was doing was I was supplying the folks at UNAIDS with podcasts of Dorian's show that they were playing inside clinics, because in Sierra Leone, where I was in Freetown, you can't be gay and have a voice on the radio. That was just completely illegal. It was just not heard of at the time. But what here for New Orleans, what the radio station has done to a certain degree has destigmatized the word HIV, right? When I named it HIV, I had 3 letters to choose from, right? And my wife says, if you give that man 3 letters, he'll rearrange them in some ways to find H and I and V. And if I could have named the radio station W, Human Rights and Social Justice, I would have, but I couldn't. I had 3 letters to choose from. And so the UNAIDS folks were like, this is incredible. You're helping to destigmatize the word. And here in New Orleans, when people come to me and start talking about HIV, it takes me a second to say, are we talking about the virus, or are we talking about the radio station? Because they'll talk about it, and we've taken the power out of the word HIV. And so it was so important for UNAIDS to play Dorian's shows in places so that people can hear the normalization of HIV. And so in the videos that are behind me, I'm not showing this one. This is our mRNA vaccine one, but in the 3 videos that we did with HIV, we use a person of trans experience. Her name is Milan Nicole Cherie. She's a person of trans experience here in New Orleans, and she's also she's a person living with HIV. And you may know her because she also was the activist that started the hashtag Black Trans Lives Matters. And what we do with her is that she takes us in her body for the first video, the U equals U. For the second video, for the PrEP video, we go inside my body. And then for the NPEP video, we use a silly metaphor of an old nursery rhyme. But we wanted a person like Milan because I could tell, I could tell the story of U equals U. I mean, that's something I know. I mean, as an HIV provider, certainly Eric can as well. But we figured it was best to have somebody who's actually living with HIV to explain it to me and Eric, right? It was so important for us to shift that lens onto somebody of particularly a person of trans experience because of the horrific laws. I mean, this year, what we saw in the South, we're seeing massive rates of cases and of deaths. And in Texas, after they had their horrific power outage, right? And people were literally dying in their homes, freezing to death. instead of passing laws with respect to helping to make sure that that never happens again. Texas was passing laws for making sure that people of trans experience that were teenagers couldn't play sports. The same thing happened here in Louisiana and through all the states in the South. This is following the fact that the people of trans experience couldn't choose the bathroom to be able to void in the bathroom of their choice. And so we see higher rates of HIV. We see higher rates of intimate partner violence. We just and of course in terms of the violence that people of trans experience as well. So it was important for us. It's important for me to give voices to those that are marginalized, and so the radio station does that. And of course, using these animations have allowed us to do that as well.
Well, your audience is largely patients, but you mentioned that your goal is to reach other healthcare providers with your work. Why is that?
Yeah. So, the audience that
healthcare providers to learn or understand.
It's so important for healthcare providers. We weren't taught what happened. We were all taught about what happened in Tuskegee because that's how IRBs were developed. But the knowledge usually stops there. When you dig deeper, you will find, and it's hard. It's kind of like one of these things where it's hard for a person who may be addicted to alcohol or opioid use disorder, whatever, to finally admit that they have an addiction. But once you admit that you have that addiction, right? They say that's 50% of the battle in fighting that addiction. And so I need us as healthcare providers to recognize what we have done in the past, the horrific, literally crimes against humanity, well beyond what happened in Tuskegee. That I'm actually writing a book on right now to try to document all of that. It's been documented many times, of course, but the idea for healthcare workers now, it's our generation right now of healthcare providers to stand up and recognize that we will not participate in a field that encourages disparities, in a field that allows for these social determinants of health to continue on. We need to recognize that what we refer to as social determinants of health are nothing more than laws that were put into place hundreds of years ago that got us to where we are now. It's not a coincidence that people of color have lower wages, that people of color have housing issues, that they're not able to access healthcare appropriately or as well as we would like for those to be able to engage in. All of this, again, these were not bugs in the system. These are all features of a system that was designed to do this. And the only way it can turn that around is making sure that healthcare providers recognize that and they join us in this fight to help break this cycle that currently exists. And until we do so, we're going to continue to be where we are now. And it could be another pandemic where we're going to see it so painfully. And the one thing, I wish the pandemic obviously never happened, but there were many silver linings that came from the pandemic. And one of them is that it ripped off the bandage of healthcare discriminations, of the harm that not only the healthcare system has done, but that society itself has done. And it has ripped that bandage off, and it has shown that wound plainly and openly, not only to the society in general, but to healthcare providers. And so it's made my job a little bit easier moving forward, but we still have a lot more work to do. And I really ask all my healthcare provider colleagues to join me in this fight to overturn the discrimination that exists not only in society, but also in the healthcare system.
So while I have you, I have been jonesing to get my hands on an infectious disease specialist for a while, and I have you here, and I'd like to talk to you about the Delta variant and the mixed messaging around the booster vaccine for Pfizer and Moderna. Can you help us make some sense of it all? I just heard this morning that Pfizer will finally get full authorization.
Absolutely. The mixed messaging that we're hearing about the boosters it's several. One, please see my video. I talk all about it in my animation. You can find that at noisefiltershow.com. But what happened is that the vaccine was developed for the strain that emerged out of Wuhan, right? We'll refer to that virus or that variant as the wild type strain. That's how we refer to it in virology. So that was the wild type strain. And the vaccine was developed as a result of that. Now, the first variant that emerged after the first variant of significant concern that emerged out of the pandemic was the Alpha variant. And that Alpha variant, the vaccine, the mRNA vaccines, had excellent protection against that Alpha variant. And then you've had several other variants that have since emerged, but the one that we're most focused on right now is Delta. And what we're seeing is that the vaccine doesn't necessarily protect against getting infected. And what we're seeing now is the vaccine has done a great job in making sure that people who are in the hospitals, making sure that it protects against severity of infection. In other words, the vaccine is really keeping people out of the hospitals and certainly protecting people from dying. I'm on my way to the hospital as soon as we're done with this interview to make rounds, and almost exclusively in the hospital are people who are not vaccinated. So that is where we are with the vaccine itself. Now what we are seeing is talk about boosters. And so there's two types of boosters, and that's where the mixed messaging is coming from. There's one booster that is either needed for people who are immunocompromised, okay? And so we know that that has been, and there's a very definitive list. These are people who are on prednisone or immunosuppressive therapy for solid organ transplants and this sort of stuff. But what we also saw last week is that there's an 8-month approval now for another jab, another shot, if you're 8 months out. So the idea there is that there may be some waning immunity that exists after about 8 months or so. And because we're seeing this Delta variant right now, there was approval to get the vaccine once you're 8 months out. But there's another type of booster vaccine, and that next type of booster vaccine that we're looking at may be a new formulation of the mRNA vaccine. So it'll be another, just kind of like what we do for the flu vaccine every year. We get a flu vaccine every year to protect us against the current circulating strains. What we will likely see moving forward is that there's going to be new circulating strains. The one that I'm particularly have my eye on is what's referred to as the Lambda variant. That Lambda variant may be vaccine evasive. So that's something that we really need to consider as being potentially problematic moving forward. And so there may be an after Lambda, who knows? I always joke about, not joke, but I always refer to as Delta Epsilon Epsilon, you know, that they may just keep getting variants, but then there's going to be the big one that's going to come that may need, again, a whole new formulation of a vaccine. And so it's really important for us to recognize that this that we are going to be living in a COVID world for some time moving forward. And until we vaccinate the globe, right now, the last I looked, we are at about 2%, almost 2% of the continent of Africa has been vaccinated. And when we talk about Morocco, where I'm from, where my family's from rather, Morocco has done a very nice job vaccinating. South Africa has done a pretty decent job vaccinating. Everything in between has not been well vaccinated, and we have to ask why that's the case. And when you look at other lower and middle income countries, we're at about 2% vaccination rates as well. And we have to ask ourselves, why is that? And that's largely due to the fact, unfortunately, because of intellectual properties and this TRIPS waiver that President Biden had said that he was going to waive, but we still haven't seen waived at this point. And until we hear the word, the WHO refers to this, and we hear the word vaccine apartheid. And until we actually get the globe vaccinated at once, had we at the beginning, this time last year, folks like myself were begging for countries like Brazil and Thailand and India to be able to develop their own mRNA vaccines, right? That the waiver should be waived altogether, or the intellectual property should be waived altogether, so that people in these different countries that have great biotech technology, like Brazil, like India, like Thailand, could have produced enough and manufactured enough vaccine so that we could be in a better position where we are now. Because every person who gets infected with COVID, their body becomes basically a laboratory that can kick out a new variant. And we're going to be dealing with these variants for some time. And consequently, we're going to be dealing with more boosters as well.
I wanted to circle back to something else you mentioned before. And I guess, so you talked about, healthcare providers joining you in making change in medicine and society as well. What does that look like?
I mean, what that looks like is steps forward to making sure that we as healthcare providers and in these systems that we work within, hospitals, clinic systems, insurance companies, what have you. One is that we have to recognize that we need to move to a Medicare for all healthcare system. And until we do, we will continue to see the outcomes that we're seeing right now. There was an excellent study that was released about like 2 weeks ago, looking at Medicaid expansion in 3 southern states, and they compared that with one state that didn't have Medicaid expansion, and that was Texas. So they looked at Louisiana, where I am, Arkansas, and Georgia, that I think all expanded Medicaid, and then they looked at Texas that did not expand Medicaid, and they looked at COVID outcomes. And of course, it should be no surprise that that those people in Texas that did not have a Medicaid expansion had worse COVID outcomes, and that was even especially worse across racial and ethnic lines. So it's so important for us to recognize that we need to move to a Medicare for all system, and we need to eliminate all political excuses. Now, we know what the reason is. People don't like to talk about it, or it's usually spoken hush hush, but it really comes down to that the insurance lobby system is one of the most powerful in DC, and they basically through the form of campaign donations, which is really just referred to as a bribe, are able to make political donations to politicians, and they just turn the other way. And they do not allow us to move forward with this idea of healthcare for all or Medicare for all. So that's the first thing that we need to do. The second thing that we need to do is we need to increase the diversity of medical schools right now. No more excuses. We need more people in medical schools because Doc Griggs, so I never wear scrubs. I started wearing scrubs because of COVID, right? Because when I go to the hospital, I can't wear a suit like I'm usually wearing there. And Doc Griggs and I, part of our on-air banters, he always makes fun of me for wearing scrubs, and I always make fun of him for wearing suits, and I always make fun of him for wearing scrubs. And it's really a setup for him to tell the story that he tells all the time effectively, which is I wear scrubs because I want children to look at me, right, and for people who look like him. You know, I want children to look at me and say, oh yes, there's a doctor. That's something that I could be part of. And as 100 Black Man organization says, if they see it, they be it. And so it's so important right now for us to increase medical school matriculation to communities of color right now. So this way, moving forward, children in future generations will be able to see folks that look like themselves, that sound like themselves, that speak the language of what they speak at home. And so we need to, as healthcare practitioners, we need to advocate for that. And then lastly, we need to advocate for anti-racist, anti-misogyny, and anti-trans and homophobia policies in all of our workplaces. And that needs to happen right now. We need to, if we really want to turn around systemic discrimination that not only exists in society, but that exists within the healthcare system, that gets done on a policy level. And I'm calling for all my healthcare workers and colleagues out there to work with me in the systems that you work within to help develop these anti-discriminatory policies so that we no longer will have these policies that lean toward racism, that lean toward misogyny, and that lead toward trans and homophobia. You know, policies that, again, on a statewide level, don't allow young children to play sports, right? I mean, this is just the most insane thing that we tolerate that. And because it happens on a larger level, that sort of thing trickles down quite literally. And so I'm calling on my healthcare providers to join me in this fight, because we have to break this cycle of discrimination that exists right now.
Thank you so much for your time today. I hope you'll come back and talk about any new initiatives or education programs on the horizon. Thank you. I know
absolutely
you to the hospital, but thanks so much for your time, Dr. Déry.
Thank you so much.
Okay, bye.
Bye-bye.